When providing comfort to patients who are in pain, you would first perform hand hygiene, identify your patient, and apply gloves. Assess your patient for pain using various scales such as the 1 to 10, 10 being the greatest pain threshold and 1 being minimal pain. If the patient is unconscious, you can use the FLAC and use facial expressions. If your patient is conscious and they do say that they have pain, offer pain medication if it has already been previously ordered by a physician. If it has, you can provide necessary pain medication to your patient. Allow 30 to 60 minutes for the pain medication to take effect. In the meantime, other options such as adjusting the temperature so the patient is comfortable, adjusting lighting, reducing noise so that they can rest. Always provide privacy to your patients. Simple things as reducing odors such as keeping soiled bed linens, taking care of emptying trash cans so there's no noxious odors to bother the patient. You can also offer to adjust the patient in bed so that they are more comfortable, making sure they don't spend too much time in the same position. You also want to kind of group activities together, such as range of motion exercises or PT, so that the patient does most of their effort at the same time and then has enough time to rest and relax between. You want to make sure your patient is always well hydrated, providing access to drinks if they are not on a IV for hydration. You want to make sure that the bed linens are smooth under the patient, that there's no tubes or wires underneath them that could cause any indentions or pain from them laying. You want to assist the patient whenever they are ambulating and provide range of motion exercises in limbs that they may not be able to move themselves. Offer spiritual assistance for patients. You also want to offer distractions such as reading, television, interacting with others, even if it's just sitting down and having a conversation with the nurse. Encourage relaxation, such as deep breathing exercises or muscle relaxation, such as tightening and releasing muscles in a specific order to allow the patient to focus on something, work through the pain, and then release that tightness. Guided imagery, asking the patient to focus on something specific, preferably something happy from a memory or something they enjoy doing or talking about. Other options are offering hot or cold compresses to the affected area to relieve some of the pain from swelling. If the patient is if the patient is okay with it, massage is also an option. When you are done providing non-pharmacological options to the patient, you always want to remember to remove your gloves, perform hand hygiene, and document anything that's happened. Make sure your patient's bed rails are up. Make sure the patient's bed is locked, and you also want to make sure that the patient's bed is in the lowest position and they have a call light accessible to them.